So our next speaker is Jeffrey Zemla, and he is an assistant scientist in the UW Department of Psychology, working with Dr. Joseph Osterwell on semantic memory and Alzheimer's disease. And his presentation is entitled Modeling Semantic Fluency Data in Alzheimer's Patients. So, Jeff.
Thank you. So if I ask you to list as many animals as you can in a minute, most people are pretty good at this. They can do it quickly, pretty easily, and effortlessly. So this task is called the Semantic Fluency task. And it's been used for decades in psychology because it tells us something about how memory search is performed in healthy individuals and how concepts are organized within semantic memory. But it's also used in Alzheimer's patients because Alzheimer's patients produce data that's different from healthy controls in a lot of key ways. So as part of the cognitive linguistic quick test, as part of the UDS. So to give you a few examples, compared to healthy controls, Alzheimer's patients tend to list fewer animals overall. They tend to generate more perseverations, so they repeat themselves within the list. Healthy individuals will list sequences of semantically related items in clusters. So for instance, they might list lion, giraffe, and zebra, which are all African animals. Alzheimer's patients do this to some extent as well, but the clusters they generate are smaller with fewer items. And there's also fewer cluster switches overall. And so in the literature, there's a whole bunch of other measures that purportedly differentiate between the semantic fluency data of healthy individuals and Alzheimer's patients. And so we wanted to build a computational cognitive model that could explain how fluency data is generated, not just in healthy individuals, but also explain the mechanisms that might lead to impairment for Alzheimer's patients. So the way we did this is we started with a semantic network, which is an abstract representation of semantic memory. It's made up of a set of nodes which represent concepts. So here we have nodes such as wolf, dog, cat, lion, tiger, zebra. And then you also have a set of edges which connect nodes that are semantically similar. So for instance, cat and lion are connected by an edge because they're both felines. Dog and cat are connected by an edge because they're both pets, but dog and lion aren't connected by anything. So the way our model works is we think that fluency data can be approximated by a censored random walk on the semantic network. So you might start at some random node in the network, such as cat, and you take a random walk, which means you follow any of the edges at random that are connected to that node. So you might go from cat to dog, and our model would predict that your fluency list would be cat and dog. Sometimes if you take a random walk, you're going to traverse over the same node more than once. So you might go from cat to dog and then back to cat. But we think that healthy patients have an internal monitoring process that prevents them from saying the same word more than once because they don't have perseverations in the data typically. So even though the walk traverses cat more than once, the patient will say it only the first time and not the second time. But we think this monitoring process is impaired in Alzheimer's individuals, so that if the walk traverses over the node more than once, there's some probability that you do emit that word and it's not censored, even though it should be. And similarly, there's some probability that you might traverse to a new node, such as lion, but for Alzheimer's patients, it's censored, even though it shouldn't be, because it's a new node. So we wanted to understand whether an increasingly faulty monitoring process with this modeling framework could explain the impairment seen in Alzheimer's individuals. So the way we did that is we compared our model predictions to a longitudinal corpus of data collected by the University of California, San Diego, ADRC. From their corpus, we identified 32 patients who transitioned from normal control to probable AD diagnosis. And then for each of those patients, we looked at a 5-year window surrounding their first Alzheimer's diagnosis, which left us with about 129 lists, or about 4 per participant. So each patient came in once per year to do a battery of tasks. One of the tasks among that battery was the semantic fluency task, which lasted about a minute. Okay, so here's what I'm showing you is just the raw data from the semantic fluency task. I'm showing you 3 measures. On the left, you have the total number of items that are produced in the task. The middle is the number of perseverations, and the right is the average cluster size. But on the y-axis, what I'm doing is I'm z-scoring everything within participants. And then on the x-axis, what I'm showing you is the year relative to their first Alzheimer's diagnosis. So year 0 is the first year in which they were diagnosed as probable Alzheimer's. And I'm also showing you 1 year after that, and then 3 years before that, whether they were diagnosed as healthy controls. So we seem to replicate a few things found in the literature, which is that over time, patients who are diagnosed with Alzheimer's tend to generate fewer items, they tend to make more perseverations, and they tend to generate smaller cluster sizes. So we also perform simulations using a semantic network from the literature to make model predictions, which I'm showing here in red. So at least qualitatively, the model seems to make similar predictions, which is that as this monitoring process becomes increasingly faulty, it produces fewer items, more perseverations, and smaller cluster sizes. So the fits aren't exact, but we're also busy transcribing a larger set of data so we can make better predictions and fine-tune the model a little bit more. So what I like about this approach is there are a few things. So I think it's a simple computational model that explains a potentially complex behavioral phenotype. There are a lot of differences between healthy and Alzheimer's semantic fluency data, and the model will make predictions about all of them. And it doesn't just look at the total number of items and perseveration rate, which are the two criteria used for clinical diagnosis. It also uses a within-subject longitudinal design. So there are hundreds of papers on semantic fluency data with Alzheimer's patients, but nearly all of them use a cross-sectional cohort where you have the Alzheimer's patients and the healthy controls. And they don't look at how individual participants transition over time, which is a problem because there's a lot of variance. And then potentially we can use parameters of the model to link to behavioral covariates such as the mini mental state exam or biomarkers. So that's sort of a future direction for us, and you can talk to me about that at the poster session if you'd like. I'd also like to give a short plug to this sort of software tool that we're building. So if you do use semantic fluency data, or if you'd like to analyze semantic fluency data, we built this tool where you can upload your data, and it will spit out a whole bunch of metrics about all the different lists. It'll calculate things like intrusions, perseverations, cluster sizes, and so forth, and also some model-based measures. So it can actually estimate semantic representations for patients based on their fluency data. And so you can actually download this tool today and also ask me about it at the poster session. So I'd like to thank my co-author on the work, Joe Osterweil, who's an assistant professor in the psych department, along with our collaborators and our research assistants. Thanks.